Dr. Bill Adams here, and this is a special edition No Spin Live, and we have a lot to talk about. We have our 4 incredible plastic surgeons who know No Spin Live Italy, but this is a special situation, and actually a very serious situation with the coronavirus COVID-19 epidemic. Obviously, Italy has been one of the hardest hit countries, and we have Dr. Adriano Santorelli from Naples, Italy, and Dr. Francesco Cirillo from Rome, Italy, Barbara Cagli from Rome, Italy, and Andrea Spano from Milan. So we have all of representation from all of Italy, North Italy, Central, and South. So Adriano, why don't you lead us off? And this is a very serious situation in Italy, but I think there's also quite a bit to learn. So lead us off and tell us where things stand.
Hi, Bill. First of all, I want to thank you for this chance to share our experience. I am in Naples. Actually, it's not simple to move. I have another house outside Naples on the sea, but it's impossible in this moment to move my family because the other people don't want that we move. You know, Naples is a very big city with 1 million of people. For this, I would like to stay in another country, but it's impossible. It's impossible to work. I am totally stopped with my activity, my surgeries. Every first consultation, I am only doing some consultation, video consultation, but this is not the worst message because totally is stopped. We cannot go to the restaurant. We must stay in line outside the chemistry, outside the supermarket. If I have, I have 2 daughters, very, very little daughters, and they must stay in apartment. They cannot go around the city, walk, go on bicycles. For this, this is our experience, and now we can talk a lot, but the message is always the same. We have a lot of friends in Europe and the States. Our message is to take care of this problem, not when it's too late. You can anticipate this problem. You must share our experience.
Yes, no doubt. So Francesco, you're the president of the Italian Society of Aesthetic Plastic Surgery, but this obviously is much bigger than just plastic surgery. So tell us your thoughts and maybe some important messages that people should listen to.
Hi, Bill. I am the president of Italian Aesthetic Plastic Surgery, but now I am the president of nothing. Because the problem is that our aesthetic surgery activity is totally blocked in Italy. To respect the moment of great stress that our hospitals have, because in Italy we have 12,000 of people that are infected, and we have most in north of Italy more than 1,200 of people that are hospitalized in intensive care. So aesthetic surgery is unnecessary, but it's our job. And for a civic sense, we blocked our activity. It's a very sad period. It's very sad to see our cities, Milan, Rome, Naples, that are like a desert. And in the eyes of the people that you meet, windows by windows, because we are blocked in our houses, you see the fear, and it's a very sad period. So please, I want to share our experience with American colleagues. Please don't underestimate this problem, please, because maybe we did this underestimation in the past, and maybe, I don't know, we pay a little bit, and the rest of Europe must now are doing the same mistakes. So please, we want to share, we want to send a message to American colleagues. Please don't underestimate this problem.
Barbara, do you think, did people underestimate the severity of the disease, and what advice would you give? You know, we're really talking more as just doctors and in healthcare than really plastic surgeons.
Yes, I want to show you this sentence. It means hashtag I stay at home, io resto a casa. This is now everywhere, all the city, all the TV, everybody's saying this sentence that you have to remember also in the United States. So our recommendation is you stay at home. That's the only way to stop, to block the virus. I'm a plastic surgeon in the hospital of the breast unit. I'm going only to do oncologic surgeon, but not prophylactic mastectomy, only cancer surgery. For people who cannot really wait for 1-2 months. That's our recommendation in Italy. So the hashtag, the more important feelings is stay at home. That's our deal.
But do you think that a month ago were people not following these guidelines, or what do you think?
Now they are finally following, because at the beginning we thought it was only a problem of the north of Italy, because we have a red zone, call it like this. It was the most dangerous zone. Actually, all the Italy finally is become a total red zone. It means that everyone has to follow these rules. We must stay at home. We don't have to do nothing unnecessary. When you go to the supermarket, you will find a long line because we have to stay at least 2 meters apart from each other. Everyone that can take a mask to avoid contamination. We have to use gloves to wash our hands. Now everywhere, if you go in the city, you don't find anyone. You only find written everywhere, also on the TV, every 1-2 minutes during a film or everything, there is this sentence, this rule to follow, to remember people. Now Italians are finally afraid. So now it's working.
The problem is that 1 month ago, we thought that this flu was normal flu. This is the big mistake. It's not normal flu. Spread too much is very aggressive. It's not aggressive only with the old people, with everyone. We have a lot of players, so football players, and they are sick in this moment. Over the best team of Juventus, Inter Milan, young, very strong people now are sick.
Adriano, when you say that people thought it was a normal flu, is that because of the way the media portrayed it, or what was the reason for that?
I think that because it was only a simple message, optimistic message, it's a normal flu, only the older people. I don't know if at the beginning is a medical problem or a mediatic problem, but we are doctor, and in the beginning we thought that it was a normal flu, only the older people. But I don't know what is the origin of this big mistake.
Yeah, Andrea, so you're in northern Italy. So tell us what's going on there and what you're seeing, and you're doing also some oncologic surgery as well, right?
Right. I think that we underestimated because at the beginning the mortality rate is not too high. That's the big problem. The problem is not the mortality rate related to this virus. The problem is the health system, that we are completely messed up now. But I not totally agree with what Barbara said, because I think that still now we didn't stop people moving from home. Because in Milan, I had surgery this morning. I wake up at 8 in the morning, and in Milan there was a lot of less people than every day, but still too many people going out because the government didn't oblige people to stay home. If I have an activity, like I'm a lawyer, I work in business, I can get out. That's the problem. I can get out to go to the market. Of course, I have to feed it. That's fine. But all the commercial activities, they are stopped. But all the professional activities, they are not stopped. So people can get out. It's enough to show to the policy, to the police officers, just a paper with wrote down where are you going, and then if you got out from home just for work, that's fine. I think this is not enough. There is still too many people in the cities. That's the situation, I think, in the north.
The problem is that people, we don't know more things about this virus, and people have fear about this virus, and I think that all Europe have a really fear about the economic rebound of this problem, because we don't know what will be the duration of this disease and this epidemic. And we don't know what will be the duration of this state of to stay at home, to have this block of our job. We don't know. This caused a really fear in the mind of people. So we are not sure about nothing for the future. We hope that with the good season, this problem can be a solution, but we are not sure about it.
Barbara, yeah.
One important thing we know is the China experience. We have seen that there it stopped. So it means that we know something very important. If we avoid contacts, we can stop the virus. So I think this is the main message we have to give you. I also know that Trump, we read that he stopped flights from Europe. That's fine, of course, but this is a pandemia. So remember that everyone in our country must do everything. I think this is the take-home message of today. This is the big problem. Thinking that it's an Italian problem or European problem, that's a big fault. This is a worldwide problem, I think.
Yeah, no doubt it's a global problem. And so you all are talking, I just brought these few teaching points, but these are the 4 stages, okay? So you have containment, then delay phase, and then research and treatment, and then mitigation. So now in Italy, you guys are, in this delay phase where you're talking about social distancing, staying at home, because I think one of the issues that you both are all brought up is that there are so many cases in Italy that came very quickly that the healthcare system in some areas it's overcapacity. And so that's where this delay phase, where people need to stay apart, no big gatherings of people, that sort of thing, that's effective in the public health care system to kind of flatten that curve, if you will, of the number of cases, and therefore allow the healthcare system to still be able to treat the people that actually get very sick. So what do you all think about there are quite a few patients who have very mild disease with this. Is that what you're seeing? Because that's also people that don't feel ill, but they can transmit the disease, correct?
Correct, totally. This is another big problem. Many patients are asymptomatic. So that's why you have to stay home, because you don't know, maybe I'm okay today, but I'm not sure that I don't have coronavirus. So that's why we have to do not see each other, no?
What are the practices, that anybody should be doing to minimize transmission and problems with this virus?
Bill, is like a movie. When I go out to the supermarket, when I come back, before my daughters arrive to me, I go directly to the bathroom, I wash my hands, then I have chlorhexidine, I wash my hands again, my mouth, and my dress, I wait some minutes before my wife or my daughters can touch, because the virus is very, very strong and can survive on the layer, on the metallic layer on the surface for many, many minutes, or probably many hours. So for this, they cannot touch my dress when I go out, because it's possible that I touch, the car or something, the bag of the supermarket. For this, it's very resistant. It's like a movie. If you have seen some movie about contagion, about disease, it's the same. Then I am with the mask, with the gloves. Is incredible.
It's amazing, Bill, because our generation in Italy didn't live the experience of the war, and this is, it seems, an after-war or a during-war living in this period, because people are afraid about everything. People stay with a mask. People are afraid to go on the balcony of his home. People are afraid to meet every people, every person. So is a very strange situation, and I think that this experience will change our behavior, because is the first time that we are living this kind of situation. So I don't know what will happen in the future. Totally is blocked. Bill, tomorrow will be the birthday of my mom, 90 years. And it's impossible to have a party, maybe by Zoom, by Skype, a little cake with him and my brother, but far. Not I cannot kiss her. It's very touching. It's a very touching moment. So please learn about our experience, because it's very hard. I believe in me, it's very hard.
We certainly wish her a happy birthday, Francesco, and that, you know, that's actually another good point, that, you know, especially people that are older, people that have medical problems, the people that are immunosuppressed, those are the patients that are particularly susceptible to bad issues with these type of viruses, so that they need to be particularly careful. So yeah, I think probably a Zoom birthday party or a GoToMeeting birthday party or Skype is probably the way to do it, Francesco.
Yeah, it's amazing. Maybe you can there are many videos on social and that show in Naples many people that sing a song by the balcony of their homes. And it's a new kind to meet someone far. We want to stay together, a little bit far, but we want to stay together, because I think that is the only way to fight the fear that in this moment we have.
What about vaccines, treatments? Where are we on those? Are there any treatments coming down the road? How long will it be before a vaccine will be available?
They are studying a lot. They're using therapy for HIV patients in Spallanzani Hospital, which is the most important hospital in Rome. And they are using some, but in an empiric way, because now they are studying also an immunosystem antibodies monoclonal therapy, which is used for arthritis rheumatoides, which works very well for the arthritis rheumatoides, but they are still anything sure, because to do and to have a real vaccinum, you need a lot of months. So they are all walking in this direction, but we still don't have any real therapy for this disease.
The first outcome should be to have the serum of the people that now they contracted the coronavirus, but now they stay good. If we have this serum, we can try to treat the other patients with this serum. This is the first outcome. The second one could be the vaccine. obviously. And maybe in Israel there is one lab that was working on this vaccine, but not the coronavirus of the man. Very close, another coronavirus of the duck. For this, probably in Israel, in a few months, we could have some good news.
The problem that we have, sorry, Bill, that we don't know if these coronavirus create antibodies and in which way create antibodies in our body. So we don't know if people that had a coronavirus infection have antibodies against this coronavirus. So we don't know nothing. And this is the problem that we don't live. We are living without any sure things in our lives in this moment, with many fake news. Because the fake news in this period, we are full of fake news.
Yeah, I think that that's exactly right. Nobody really knows. There will be obviously treatments, there'll be vaccines, but it could be estimates probably go from 6 to 12 months from now that those things would be available. So in the meantime, a lot of these other practices like just good hand washing, keeping distance from close interaction with other people, because the truth is now this containment phase is over with, especially where you are. That now it's a community spread, so it's not like you're going to be able to, it's being transmitted from across people's families, things like that. So these good practices that you all have talked about are excellent information, and I think people will be able to use those to try to really kind of delay the onset of these cases. So just in conclusion, I'd like just to hear some concluding remarks from each of you. So Adriano, why don't you lead off? Tell us what your concluding remarks would be.
I would like to close with a positive message. And the positive message that when you are alone, you understand how much is important meeting the people, share the experience, the meeting, the friends. For this, I hope that when all these will be finished, we can be better personally. And how is important our job, our work, how is important for a man to go every day to work. And for this, is very bad period, but is like spiritual period for me this moment. And I hope that it's impossible that in one day can change everything, but slowly we are a very strong people, and I think that Italy now have a little advantage. The advantage is now we are doing for very strong restriction, but I think we'll be the first to go out of this problem.
I totally agree. I mean, we are surgeons, but we split our time in between surgery and other activities, like to plan our practice, to plan our things except surgery. And now that we have, of course, much more time to think, to try to understand how will be the next months, we have to focus on this. I think we will have an economic collapse in Italy. We will have an economic and a health collapse in the next months. Won't be so easy to recover from this collapse. So I think that every doctors should use this time to try to find out the way to start over.
Barbara.
Yes, I agree with all they said, and I really said to everybody that we need a lot of patience, because it's not 2 days, it's a long period. So try to use our best for this period and be patient and wait and respect all the rules.
I'm 35 years that I'm married. I didn't spend so much time with my wife like in these days, but I'm happy. This is the message. There is a way. I'm happy to stay with my wife in my home to fight this virus, because there are many things. There are many other important things after the job, and family is the first. Thank you.
Yeah. But I've met your wife, Francesca, and she's delightful, so I'm sure that you're having a great time. So, well, listen, you are all great plastic surgeons, but you're also great doctors, so this is all really great information for our viewers, and I just, again, what you've heard is good practices. So we have these 4 phases that we're working on, but this kind of delay phase, people should really think about washing their hands and using good practices and not going out in crowds and really staying more at home so you can deal with this public health crisis, because as we said, public health is of the people, for the people, by the people. So thanks so much. Thanks for sharing those experiences with us. And if you want to see more of this, you can see it on the plasticsurgerychannel.com.